Thank you for coming over for this meeting. And this is what is important is this is a very challenging case for us because this patient is a 70-year-old lady who's got a comorbidity. That means she's got a very associated other diseases like lung disease, and that lung disease was chronic obstructive airway disease. That itself is a very dangerous one to have for a chronic thing that she's been suffering. Also, she's got diabetes, hypertension, and heart disease. So all comorbidities were so high with this patient, and unfortunately, at that moment, she also suffered from COVID. And she got this virus, and she was having very high fever, short of breath, and by she slipped and fell down and broke her elbow. So she had gone to elsewhere hospitals where they couldn't do it because it is such a high risk case because of the COVID positive with the shortness of breath and so many other diseases along with it. And this fracture itself is a very complicated fracture. So she was referred here to our team, and straight away she was taken to ICU because of her condition was so bad, and that had to be first sorted out. So she went for that, and ICU, our team of doctors, which is headed by Dr. Buddhadev and anesthetist heading by Dr. Vidya, and that has helped this patient to recover, because intensive care is very important. It's teamwork. It's not only just the orthopedic, but we have to see the patient as a whole. And this patient was admitted straight to the ICU, and it took first with a high level of oxygen to give, and with a positive pressure, her oxygenation was increased and she became better slowly. But it took her 3 weeks. It took her 3 weeks. It is in the elbow. Elbow joints are very complicated because it is near the joint. If there is a lot of other movements are there. So it's not like a ball and socket joint, like the hip or shoulder, where it is forgiving, even any kind of a surgery, if you do and if the bone joins, then it is possible, it will forgiving because of the ball and socket, it will cover the thing. But in elbow and ankle or the knee joint, it is not a complicated joint because certain movements are there. And if you don't get it, she will get a complete stiffness, and also the functionless it becomes. Being a right hand, dominant hand, so it's very important for her to get that. But to do the surgery, first of all, we can't do under local anesthetic. This fracture is in the proximal limb, so where we have to give general anesthesia. So that is where our anesthetic team comes into play. And to get them fit for anesthesia first, the ICU doctors have done the work first, to get her oxygenation better, and at one level she became fit for that window period. They became a little fit, so we took them out. So we took her out for surgery. Then this shows the CT, the CT of the elbow, how many fragments are there. You can see that so many other fragments are there involving the joint itself. It is broken, I'm sure. Yeah, you can see that with the pointer that these are all the fractures, and the joint itself is gone. And you see that this is the X-ray. X-ray shows 2-dimensional, and we need 3-dimensional is by taking the CT. So once we get a CT, we know how to organize it. And so what this shows further pictures in different directions we take it to plan our surgery. So because this another complication with this patient is that we have to put her in a position where we put it upside down, face down, so that the elbow can be approached by detaching this bone. We detach this bone from there with the muscle, and so that we can approach here. And this elbow is complicated because of the vessels and the nerve and other things are in and around the joint. So you have to make sure that which goes around all around this place, and we have to put a plate there so that we get a full movement. So these are all a little challenging for the surgery. And See, this is what has been done. At the end, we put both sides plates so that all the fracture has been reconstructed back. And this is a spot where we removed that bone, reflected, and got it back. So once you do something like this, the bone is very weak. Because she's 70 years old, the ladies also have the problem of osteoporosis. That means the bone becomes very weak, the calcium and vitamin D3 level goes down. So it's very important to even support, and fixing these plates are challenging because it can come out, because the bone is not strong enough. So there is a newer one, we have all locking plates, so where the screw locks to the bone as well as the plate. So it helps in the healing. So, because we have one chance, if you don't do it correctly at that one chance, she will suffer lifelong, with the stiff elbow. And when your elbow is stiff, you can't do anything, You can't use your dominant hand, right hand. So, this is the final one to show. She got fully recovered from this, and she's got full function there. And now, after this, because we wanted to show after 3 months, once it's all joined, there's no point in showing immediately post-operative. And we have to know the results finally, when she's back to normal, she's now able to do all her functions back. And since she was COVID positive and the patient we didn't want to put her here, so she's come on live. We can talk, we can ask for her interview also. That is even easy now with the FaceTime and video calls, So we arrange for that so that we can have an interaction with the patient. And so at the end, it is because of our hospital where we have 24 hours, all the departments available, the ICU, the transplant thing, and the blood bank, as well as the anesthetist 24 hours available. We are able to achieve all these results. If you lose at the beginning, the patient will be lost. They are breathless. Even if you leave them for an hour or two, it becomes irreparable lung changes. So immediately it was given, and the emergency treatment given, and she's back to normal now. So the best part about it is, she's like a normal person with all the movements of the elbow, even the turning around, the facing up, then bending the elbow. So this is really, to get this achievement, I thank all my team, and these are my team doctors, Dr. Adiman and Dr. Yukesh. They are orthopedic surgeons too, and they are working with our team. And unfortunately, our main anesthetist, Dr. Vidya and her team, and the ICU, Dr. Buddhadev and his team couldn't make it because of the work and this being this time, lunchtime. So this is what I want to tell you. Thank you. If you have any questions, please go ahead. And this patient she's on line now. Yes. Yeah. Can you make it straight? So this is Mrs. Saraswati. You talk. Just ask her how she is now.
Hello.
Saraswati,
madam, எப்படி இருக்கீங்க? கேக்குதுங்களா?
கேக்குது சார்.
எப்படி இருக்கீங்க?
பரவாயில்லை சார்.
கையில ஃபுல்லா நவுத்துறீங்களா?
என்னது சார்?
கை மூவ்மெண்ட்ஸ்லாம் ஃபுல்லா பண்றீங்களாமா? கையை ஃபுல்லா நவுத்துறீங்களா?
கையில.
Yes.
Right.
Very good.
Okay.
சரி, மக்கில வச்சுக்கோங்க.